How should families where cystic fibrosis is known manage future pregnancies?
Yeah. So this is, as it is very clear that it is a genetic defect. There is a defect in the CF causing part of the genetic material. So once a diagnosis of CF is made or suspected, we should get a genetic test done on the child. So we are aware that this is the defect which has been inherited by the mother and father. And parents should be aware about it that there are 25% chances for each pregnancy that the baby may be affected with the illness. 75% chances that the baby may not be affected. It may be either carrier or a normal child. So in that situation, the first step is, if they are planning another baby, to get the test done on the current baby so that the defect is known. And when the pregnancy is between 8 to 11 weeks, then generally one test is being carried out, and that test will take some part of the baby by ultrasound guided from the mother, from when the pregnancy is there, from the baby's part by ultrasound guidance, and that is tested for the defect which was identified in the current child. If it suggests that yes, it may be affected, then the doctor will tell the family regarding that the baby may be affected or baby may not be affected. Then it is up to the family to decide whether to continue the pregnancy or to stop it then and there. It is very important that if some family has a child who is suffering from cystic fibrosis and something happens to the child, and then they lose contact with the treating physician, and then suddenly they come back with the second child suffering from the same problem. So they should be aware that they should not forget that the disease will recur in almost 25% of the pregnancies, and they should be aware, or they should tell, or they should contact their doctor that what can be done for the prenatal diagnosis. So if someone is marrying in the same blood relation, then defective mutation will be more or less similar in both the partners. And the chances of a baby getting these mutations, abnormal mutation from the mother as well as from the father, then the chances of getting the disease is more. That's why I said, if someone is marrying within the blood relation, chances of defective genes in them is more, and the chances of baby getting the disease is more.